Hello, everyone. Welcome to another LifeWriting.com blog talks. I am Chris Jones, your host. With me today is Miss Millicent Duncan, who is a nurse practitioner in Savannah, Georgia.
Hello.
Hello, Millicent. How are you?
I'm well. How are you?
Good, good. Thanks for asking. So, look, hey, thanks so much for being here. We're going to jump right into it. Have a fun show, a couple things lined up or what have you, and I'm so looking forward to your responses. All right.
All right. Well, it's a pleasure. I'm looking forward to having a conversation with you.
Sounds good. Sounds good. So, you are a nurse practitioner. I've always wondered what in the heck does that particularly mean? I can surmise a little, but I figure I just posed the question to you so you can just kind of share a few tidbits with respect to what it means exactly.
As a nurse practitioner, we are a role as a provider. We are more on the diagnosing and treatment side. So we are an adjunct to the physician in Georgia because some states you do not have to have a supervising physician. However, in Georgia, you have to have a supervising physician. But
Okay.
we are adjunct to the physician and we are able to diagnose and treat for different comorbidities or life. I don't want to say life. We are able to diagnose and treat on more
Okay.
also on the diagnosing and treatment side.
Interesting. So, how long have you been in that particular role?
I have been a nurse practitioner. I graduated. Well, it's an interesting story because it's been a struggle for me. I graduated
Okay.
nurse practitioner school in December of 2018. I completed my boards 2019, May 2019. I gave myself time to study and rest, but I was not actually able to land a job until 2020 at
Oh,
the start
wow.
of the pandemic. Mhm.
Okay. Wow. As a nurse practitioner,
Correct.
you were unable to, well, it took some time to land the job you wanted. Wow.
Um,
Well,
well, many in some areas around the country, there is an oversaturation. Not there's an oversaturation of nurse practitioners, and then also there are some limiting bylaws from medical boards in different states that do not allow nurse practitioners to practice independently. So whereas there are
oh,
need for individuals who need primary care physician,
mhm.
where we are still limited in the scope of under medical boards in certain states that will not allow us to practice independently. And for instance, in Georgia, a physician is only allowed to have, don't quote me, but I think it's 4 nurse practitioners that he can state he supervised over.
Okay.
Um, so it limits your ability to be a provider. And then also in Savannah, Georgia, our population is 150,000, and it's just a little oversaturation.
A little oversaturation. Okay. Well, I mean that makes sense. I mean, thanks for breaking that out. I've always seen, the name, the term, the title, or what have you, but I just never truly knew or even thought to even ask, what it really meant. My cousin Jennifer, which she's been a nurse for eons as well, and
We have
yeah, I never even thought to even run it by her. When I was initially curious about it. But yeah, thanks for sharing that. So, because you are a nurse practitioner, you know, you were a nurse proper at some point in time.
always.
Um, so, when you were a nurse, or particularly now, because you said you became a nurse practitioner in 2020. So, this thing called COVID has been around for a little while, right?
Correct.
So, do you care to share any dealings or experiences as it relates to that?
Well, my experience, I had the opportunity to experience COVID in a dual role as a nurse practitioner and then also as a nurse because I still would float and do time at the hospital. So I landed my first job as a nurse practitioner with the research company. The research company that I work for as a nurse practitioner, I work as the unblinded role in clinical research, and doing the co- we were performing the COVID vaccine trials. So in Savannah, Georgia, I was the first individual to administer the Moderna vaccine to the first person in the United States. Um,
Really?
mhm.
Oh wow! I'm glad I asked the question. That is
So,
cool.
so I was able to be a part of the research to see how it unfolded in regards to how important the need to have participants in the vaccine trials,
Yeah, yeah.
so that we could get the necessary research material out so that a vaccine could be produced to help that it to be administered the way that it is being administered today.
Wow.
Mhm.
Now that again, I am so glad I even posed the question. Wow, well, big kudos to you. Kudos, we use that in and around the military a lot. Wow, that is really interesting stuff. And thanks so much for sharing that. You talk about an experience and a memory in itself.
It was it was a challenging memory because um, they it, especially amongst our community,
Okay.
I did not expect backlash. And I expect because you have your friends who identify you on like, oh, I know she's covered up, but I know who that is. You
Oh,
know, and they weren't all warm and fuzzy with and I it wasn't all warm and fuzzy. So
okay.
I felt their concern. I felt the concerns, and I understood them. And then I also performed as a nurse on the weekends in the
Mm,
hospital.
mm.
And I remembered my first weekend having to go to work on the COVID floor, and that's where I work every weekend. I work there, not every weekend, but when I work, picked up weekends.
On the
And
COVID floor.
yes,
Wow.
because you have floors designated for COVID,
Yeah.
and the anxiety of gowning up and did I wipe everything down? Did I wipe up correctly? Just to exit and just to see the pain and the suffering that some of the patients endured. Um, it was, and then to know that Monday morning I was back with this research company and trying to produce this vaccine, like it almost felt like a movie at some point.
Look, I can only sit here and imagine how intense, for such a lack of a better word, that whole scenario or those scenarios could have been. Because I mean, you guys endured days, weeks, months of this. So wow, I actually I tied this to a blog talk, specifically because I wrote story, a short story. I shouldn't say a story. It was a quick snippet, just over a year ago, as you can see, March 14th of 2020. And I had this huge thing, if you will, as it related to the economy, public health versus the economy, and it just seemed as if the powers at be at that particular time was putting money over the health of the public, if you will. So I don't want to belabor that point, but I just wanted to quickly share that.
Yeah.
Um,
It
so
I kinda giggle not giggle because just a year ago, on that very date, me and my husband were packed up and ready to head
yeah.
to Miami, and you don't realize the severity of the state we were in. Well, I began to, because my husband said I think too much, but I am the type of person that began to look at things going on at the hospital, and I was like,
Uh-huh.
oh, something's going on,
Wow.
But we were going to Miami. We go to a yearly festival, and to see that they began, and in Savannah, the St. Patrick's Day is a very is a very big event in our city. It brings in a lot of money. And
So Millicent, just to let you know, I don't know if my cousin shared this with you. I played football at Savannah State out of high school. So I am intimately familiar
okay,
with the
so
events and chaos surrounding St. Patty's. Yeah,
I think we are listed like number 2 for St. Patrick's Day in the country or in the world.
absolutely.
And so to know the economic effect that it will have to cancel, like to hear them say we're canceling St. Patrick's Day was like, what?
Yeah,
Like,
yeah, yeah. Yeah, no, totally with you, and the gravity and just the brevity of that in itself. Again, I can sense it, feel it, imagine it, the whole nine. Yeah, so yeah, thanks for laying that out like that. I tell you. So let's go to nursing itself really quick. What do you miss about just nursing in itself, in the sense of nursing?
um, because I'm still involved in nursing, I still pick up
Right.
nursing shifts. Um,
Okay.
I I am me and Jennifer, your cousin,
Yes.
I'm an ER nurse by trade.
Okay.
So I love the ER. I love it. I love the emergency department. Not just with my coworkers, because it is a different sense of, not just from the traumas, um, there is just a different sense of camaraderie
Mm,
with the staff. There's a different sense of camaraderie with the community.
mhm.
Um, and I like interacting with patients. I feel like I have a calming effect. And in the ER, when you come into the ER, there is such a sense of unknown, that to know that you have that one person that is providing that calming effect for you. I love educating the community that comes into the ER, because we lack the health literacy and education that we need so much.
Right.
So I love educating my patients. I think so I think that is one reason why because before I was going to explore nurse practitioner, I really was going to explore public health.
Okay. Okay. Wow. So let me ask you, do you have anything on the horizon that's related to that, where you can kind of
I
get the
do.
best of both worlds, if you will?
I do. I do. As a matter of fact, I am in the works and researching myself. I want to start a YouTube and podcast on health literacy. Uh,
Absolutely.
and
Yes.
and I really want to start it on to speak on health literacy for the Black and Brown community. Uh,
Yes.
I would like to start a nonprofit that focuses on health literacy in the community,
Wow.
because I also worked with Department of Veteran Affairs for 5 years. I was a clinical case manager, and I had the opportunity to work with homeless veterans in securing them housing, because housing and how it affects your health does genuinely go hand in hand. And to see individuals who are on a limited income balance their health needs as well as their day-to-day living, it is a true struggle for many. And if you don't have the proper health literacy to make
Mhm.
the important decisions in regards to your health, everyone who who is literate enough to make those important health decisions, it seems easy as paying your bills. But some individuals are truly juggling um, their healthcare needs in regards to their hypertension or their diabetes, or even making the proper decisions when they go into grocery stores to manage these things, that it really sits on the back burner for many.
Look, that's such a mouthful, and look, the need, the necessity, like you said, for just health literacy, specifically public health. I mean, there's so many topics within that umbrella that needs to be, emphasized, stressed, expanded upon, and targeted, like you said, to the Black and Brown community. So, music to my ears to hear that. We have someone else in the ranks with your, expertise, your background to be able to take that on, because yes, yeah, we desperately need it. And in some areas, way more than others. Yeah. So good. Nice. Nice. So anything else you wanted to share with respect to that, or I thank you for laying that out so eloquently.
I wish I'm sitting here because this is my first time ever doing something like this, and I'm sitting here like, I know my grammar sucks, but
Stop it. No, no,
but
look.
this country girl is gonna move forward, and we're gonna push forward, and I'm enjoying it.
Yeah, that's just it. Yeah.
Yeah. Other than I'm exploring some other options that are not health related,
Okay. Okay.
but primarily, I want to continue educating my community. Um, I think that is that I'm so passionate about educating my community, and along with educating my community, I'm educating myself and talking about subjects that we just don't talk about with um, that leads to a certain sense of insecurity, and that's because there's an underrepresentation of us there in the health field, in the lead of in the manner of those individuals who are providing us care.
Yes,
Um,
I get it. Yeah.
yeah, and it's how can I encourage other. I waited 16 years to go back for a nurse practitioner. Life, what have you, fear. Uh,
Right. Right.
but how can I encourage the next young lady in high school, hey, to go for nursing, to go for don't sit on nursing too long, go for your nurse practitioner, or
Right.
just that it is possible, so that there is more, not just nursing, physicians, or just anything health related that provides a comfort to
Absolutely.
our community,
Yeah.
because that is a scary place to be in that hospital bed, or on that stretcher, or in that doctor's office, and a person who enters the room who doesn't understand you culturally, financially, and understand the decisions that you have to make,
Mm.
even if they are relatable to them, that they had to endure those things as well. Because I'm not saying that inequities are just limited to Black and Browns, because everyone faces them, but
Yes. Yes.
we just face them at a greater proportion than others.
Well, look, this you touched on it, even alluded to it, even more. This pandemic that we are still in, it shed so much light on everything that you just said, especially that latter part. The numbers are what they are, right? The kind of that old adage, numbers don't lie, people do.
Right.
The data,
It doesn't lie.
look, having, or I should say, knowing that there are people out there like you who are going to be advocates, and leading this effort, leading this charge to ensure that people that look like us have more of what we need from an information standpoint, warms my heart. So
Thank you.
look, it's good stuff, I tell you. And here's the thing too, whatever venture you plan to do in addition or outside of this or what have you, There are so many resources out there. I plan to do some more segments that are related to that, be it from an entrepreneurial standpoint, anything related to business. But ensuring that, look, people like you with equipped with your subject matter expertise um, uh, have the ability and again the resources to be able to bring it to fruition. So having said that, look, I really appreciate you being on here with me.
I thank you greatly for having me on. And like I said, I was nervous. I was nervous because I've never, and these are some of the areas that I'm trying to step out and
Right.
and explore and be comfortable at it. And I'll probably go back and look at this and just shake my head. But
Hey, well,
um,
look,
I think
that's what you're supposed to do. You're supposed to go back, take a look at it, right? Take notes, make those markers, what you did, the things you like, the things that you didn't like. Look, the same with me doing this, right? I haven't been doing this that long, but at some point, I'm like, Chris, you need to make it happen.
right.
And as you go along, continue to take those notes, tweak this, tweak that, make that better. Don't do so much of that, whatever the case may be. But the point is, you're doing something. You're getting the information out there, and you're following your heart and or passion with respect to what you wanted to do. So again, kudos to you. And
Thank you.
again,
Thank you.
thank you so much for joining me. And I'm looking forward to seeing the next phase, or however you plan to expand whatever it is you're planning to do. And if I can be of assistance, please do not hesitate to reach out and let me know.
Well, I'm gonna make sure I'm gonna make sure I keep you on speed dial because you will be.
Well, it sounds good. And well,
All
look, until the next time, you take care, and I'll talk to you later. Okay.
right. Take care.
Okay.
Bye bye.
So everyone, that was Millicent Duncan, nurse practitioner in Savannah, Georgia. I hope you guys enjoyed the discussion.